good morning. Thank you very much for having me. I must admit it was a bit of a surprise when Marty contacted me out of the blues. It's been about 2 years since I've actually done one of these talks. So I thought I would give you a little bit of background just to put my talk into context for you. I went to London in 2006 after completing my year of compulsory community service that all health professionals have to do after graduating. And at the time, jobs for physios were quite scarce, and after 8 months of hunting, I landed up in this research role, working as the research physiotherapist for a cancer research UK-funded project. I always had an interest in research after graduating, but I certainly didn't realize that I would end up working in a cancer scenario. So it was really quite an incredible experience. So I thought I'm going to just use my first-hand experience of that project that I worked on to chat to you today about exercise and cancer. The talk will just start with a brief discussion about the general health benefits of exercise that I'm sure we all know about, the effects of exercise on quality of life in patients living with cancer and cancer-related fatigue, and then also just give you a bit of background about multiple myeloma and discuss the research project and its results, and then finally just discuss a few exercise recommendations. Exercise has the following health benefits. We know it improves cardiovascular endurance. Endurance exercise like brisk walking or cycling on a stationary bicycle improves fitness. It improves muscle flexibility, strength and endurance. Stretching improves our mobility and prevents stiffness. Strength training offsets the loss of muscle mass and strength with age. And it maintains mobility and function, helping us to stay active and independent. It reduces our risks of heart disease, diabetes and obesity. And it boosts our immune system, keeping minor ailments like colds and flu at bay. And it also promotes a healthy state of mind and lifts the mood. We know that it reduces tension associated with anxiety, it promotes relaxation, and it gives one a sense of personal control and achievement. And finally, improving our sleep patterns by reducing fatigue. And there are well-known and documented benefits of exercise on physical, functional and psychosocial well-being in healthy people and people with chronic disease. But what about the benefits for cancer patients and cancer survivors? And the only way we can answer that is through research. Looking at some of the research that's done on exercise and quality of life in cancer, much of the focus has been on breast cancer, bone marrow transplant patients, colorectal cancer and prostate cancers. And most of the studies have looked at aerobic exercise, and only some of them have looked at strength training. Some of the quality of life outcomes that they looked at were physical well-being, functional well-being, emotional well-being, and psychological well-being. Regarding the physical and functional outcomes, they showed an improvement in functional capacity, increased muscle strength, and controlled body weight, and decreased fatigue. And psychological and emotional outcomes showed improvement in overall quality of life and mood states, including decreasing anxiety and depression. And cancer-related fatigue is something that I think deserves special mention. It's one of the most frequent side effects of cancer treatment, affecting up to 70% of patients during chemotherapy or radiotherapy. And it obviously results in limitations on normal daily activities. And what happens is it's often treated with rest, so avoiding physical activity and decreasing activity levels. And this can actually exacerbate the problem. You have somebody who's suffering fatigue, they limit their activity, that then results in muscle wasting, their endurance then becomes even less, and the fatigue is increased. And a study has shown that aerobic exercise can decrease fatigue and improve psychological distress in patients undergoing chemotherapy. So chatting a little bit about multiple myeloma, it's a plasma cell tumor affecting 15 to 20 per 100,000 in the Western world. The median age of diagnosis is between 60 and 65 years. And pain arising from skeletal complications is the most common presenting symptom and what sets myeloma patients apart from a lot of the other cancer patients. They present with bone destruction, resulting in fractures of the long bones and sometimes vertebral collapse, even with spinal cord compression. And the severity of bone disease varies among patients, but about 80% of patients will present with bone destruction. It's incurable in the vast majority of patients, although most respond to treatment and then enter a plateau phase lasting a median of 2 to 3 years, after which relapses is inevitable. But treatments are advancing, and although the overall survival in patients diagnosed in the last decade is 4 years, this is likely to improve with the use of novel agents. And therefore, quality of life issues in the growing population of multiple myeloma survivors is therefore critical, and which is why we did the pilot study was done. So looking at the myeloma patient, you can see there are a few problems that they experience, starting with bone destruction, resulting in pain, fractures, deformity, and muscle loss, resulting in impaired mobility, reduced physical function, and then in addition to that we have the altered social and economic status, fear of disease relapse, and anxiety over access to treatments. And the final outcome is fatigue, loss of confidence, and reduced quality of life. But obviously I said exercise is very beneficial, and we'd want our patients to be exercising, but what are the barriers to exercise in myeloma patients? And obviously it's their skeletal damage and deformity, chronic pain, long-term effects of therapy like peripheral neuropathy, steroid-related myopathy, deconditioning, and risk of further fractures. So the solution to that is to obviously research what we can do for myeloma patients. Looking at the time when they were developing the pilot study, they looked at what research had been done in myeloma, and there actually at the time were very few studies looking at exercise in patients with myeloma. Obviously with their bone disease, they sometimes considered a difficult population to investigate exercise in. So Coleman did a study looking at the feasibility of exercise during treatment in 24 myeloma patients undergoing chemotherapy and high-dose therapy, which involves having a stem cell transplant. And although it was a small sample size, they did find that individually prescribed exercise was feasible and effective in decreasing fatigue and mood disturbance. And an observational study in 2004 showed that moderate exercise either during or after treatment was associated with a higher quality of life score. So with regards to the work that we did, we looked at a pilot study of a tailored exercise program in myeloma patients with stable disease. And what we wanted to look at was whether they were interested in exercise, whether they were able to adhere to a program for 6 months, and does exercise improve the quality of life, reduce fatigue, and improve muscle strength and fitness. It was a pilot study with the aim to recruit about 40 patients, and we approached them at the University College Hospital myeloma clinic. The patients had to be in a stable phase of their disease, and that was confirmed with obviously their blood results and looking at their tumor marker. And 3 months they had to be either 3 months post completing chemotherapy or 6 months post transplant. And they also had to be free of fracture risk, and the way that was looked at was to send them for a skeletal survey. It was often part of their normal management in the UK, but if they hadn't had one within 6 months, they were sent for a recent one, and it was reviewed by a specialist radiologist in musculoskeletal problems. So what it involved, each patient, after they passed their screening, obviously signed consent and was thoroughly assessed by myself prior to starting the program. And then we designed an exercise program based on their level of fitness, their muscle strength, and individual needs identified from their assessment. Obviously with their skeletal complications, we needed to be quite careful what was appropriate and what was not.